Menopause, it just changes everything, and there are hundreds of different symptoms related to menopause. Women's health nurse practitioner Melissa Tharp is with us today to help explain some of the things that are happening. All right, so let's just start off first and foremost. What's the age range for menopause? How do you know that you might be in it?
Oh, okay. So thank you, Tanya. So perimenopause is actually the period of time before menopause occurs, and that can happen 5 to 15 years before we actually go through menopause. And whenever we go through menopause, the average age is roughly 51 to 52 years of age. So that kind of gives you a time frame of 5 to 15 years that we're looking at before we truly hit there.
All right, so, and when we're in our 40s-ish, then we should start talking to our doctor about perimenopause and what's happening and that kind of thing. What kinds of symptoms go along with that maybe we should be on the lookout for?
Yes, so a lot of times it's the tried and true what we hear about: hot flashes and night sweats. However, what else comes with that can be brain fog. So we get that trouble remembering, concentrating, focusing. We have sleep deprivation. We have mood changes. Then we start getting some bone loss that can happen, as well as skin changes. Our skin becomes more dry. We get dry eyes at times too. That can be a common complaint. And a lot of just the instabilities of mood comes to mind with that as well.
I always love the thing when you go into a doctor's office or something and you say, hey, this is the symptoms, and they go, oh, that's natural. Okay, natural, fine, but isn't there something we can do about those things?
Absolutely. And thank you for bringing up that point, because for many years women have struggled and it's always just been assumed this is just part of what we have to go through. And I always like patients to know we don't have to suffer through this. We can actually reach out to our providers, go in with your questions and ask them, what are my options? Based on what risk factors you have, you may be a prime candidate for hormone replacement therapy that we look at. And then if you're not, there are other alternative methods, which can be just lifestyle changes, diet changes. And then we have new medicine out on the market called Veoza, which is actually a non-hormonal treatment for a lot of the vasomotor symptoms, hot flashes and night sweats. So thankfully, we are now in 2025 where we can have options for women to actually feel much better and have a much better quality of life.
Yeah, and you also talked about things that we should be doing, and probably before we hit the menopause part, probably when we're in the perimenopause. You talked about bone loss and things of that nature because of the loss of estrogen. So what should women be doing when it comes to working out and when it comes to eating?
So diet changes, you want to make sure that you're getting from all food groups, but thinking about fruits and vegetables, lean meats for sure. Making sure looking at a Mediterranean diet is always a great idea as well, so that you're not so much on the high glycemic index. Looking at exercise, trying to incorporate whatever works best for you. I think we try to get into our mind, I need to be exercising X amount of times a week. It's honestly what works best for you. And then sleep, focusing on some sleep and getting that good quality sleep, decreasing screen time before we go to bed at night, very helpful to help with that as well.
Yeah, we could talk about this for the next 2 days. Unfortunately, we have to wrap things up, but I so appreciate your time and your expertise. And we're going to be putting this online. So in case you need this, in case a friend of yours needs this, you can find this interview. It'll be in the Who Wants to Know section of our website. Thank you so much for joining us. Right now, we're going to take a quick break.